And thanks to all the panelists for giving us lots of good fodder for conversation. At this point, we can open it up to questions from the room. Prashant.
So I think when we talk about improving health systems for preparedness, it means different things to different people. But one component which I often don't hear as much about is enabling public financial management systems to have greater agility, or what I would call as greater cash velocity. And in some ways, it should be a part of the health system reform agenda or health system preparedness agenda, but in many ways, it's also broader than that. And it requires investments which I think have a dual benefit. One is in preparedness, the other is in response. But I don't hear much about that. I don't hear that as a part of conversations on what is being done around it. So any comments and thoughts on that?
Anyone want to take a first stab at that? Jennifer, great.
So that's a really important goal. And I mean, obviously, that's not the sort of thing you start to do in the midst of a pandemic. It's something that you have to have been doing all along. And it may be that you're not at a point in which you've achieved all of the goals that you have in public financial management. In the case of Liberia, in the USAID Health Program, going back for a few years, we've been working with both the Ministry of Finance and the Ministry of Health for a way in which the Ministry of Finance releases its funds to the Ministry of Health to support, this is primary health care systems throughout the country, and then receives funding from USAID based upon a results framework. And so that was a really great program for us, and one that we're in the second phase of dealing with and tweaking with, because there was quite a lot of mutual learning in the first stage of that, learning about the structure and the constraints and the room for maneuver that the Ministry of Finance has, which is a group that we in the health sector have not always talked to, and trying to then address what some of those gaps and needs are in the Ministry of Finance to be able to work together in a program that supports the basic public health institutions and the clinics throughout the country. It had the added benefit in this example in Liberia, where the Liberian government was very open to both supporting public sector health services that were under its direct control, but also providing financing and help to primary health care services throughout the country that were actually being implemented by other organizations. And it was a great model, and one that with some time and with some strengthening, I think could be effective in these types of emergencies in which all of the responders are not necessarily government, but a combination of government and non-government and civil society and NGO. So it was a good example, but again, one that took USAID health workers and health professionals to a direction that we don't always go, and it enabled us, I think, to learn a lot about how we could be supportive over in that part of the government structure as well.
Can I just add one sort of idea that came up in a conversation Chris and I were having yesterday? So I think PFM for pandemic preparedness is probably unsolvable, right? Because it brings together two worlds that don't speak and don't want to speak. The public finance purists, and I include myself, don't want to build a system just for pandemic preparedness. It needs to be bigger and more all-reaching. So, and I think PFM in general probably gets a bit lost, people will correct me, between the fund and the bank already, and so there's just a different issue on how you address public financial management. One idea that came up in conversation, and Chris, you can agree or disagree with me, was, I think there's more we could do on describing pandemic risk in terms of macroeconomic vulnerability. We didn't see in any of the West African countries that poor public health systems show up in the Article 4s. You wouldn't expect to. That would be weird, and yet it was a major source of economic loss, macroeconomic risk for these countries. So I think there's more to do in describing the economic role of the health risks that we're talking about, and I think that gets it translated to a different audience and a different set of concerns.
Great. I can see a hand, but not a face. Go right ahead.
Right, Hans Trudsson from World Health Organization. One issue that you haven't really touched on here in a bit, and I think it could be partly the response to it, but not completely, it's donor coordination. We don't really see donor coordination, and what we see is a lot of earmarking, and Ture, you can say Norway usually don't earmark, but in general, it is a lot of earmarking for pet projects, also in emergencies. And that creates huge, huge problems and financial implications for the recipients, for the countries, for agencies like WHO, UNICEF, for NGOs. And that mistrust, because I think we have to be blunt on it, it is a mistrust. And I know that it's also, as Jennifer rightly said, there are appropriations, so you can just use it for certain things. But it is a certain mistrust in this. And even if you would say strategic intentions, yes, but if everybody has the same strategic intentions and then we get huge gaps in other areas, how do we deal with it? And as being the recipient as WHO to some of this funding, it's a huge problem for us, and it's a huge, huge transaction cost to try to sort this out. I mean, I just give you one anecdotal that might sound funny, but it's not. If you receive 10,000 left-hand gloves, it's quite unlikely you will get from another donor 10,000 right-hand gloves. And this is what happens. When you're saying we need an coordination from headquarters and an overview from headquarters, but our funding can only be used in countries. But in countries it can't be used to pay local health workers, even if we know, and it was rightly said yesterday, it's a key thing. These kind of limitations in an emergency, I think, creates unnecessary and really detrimental problems for us to do our job. I know it's about accountability, I know it's to build trust, but how do we do that? Thanks.
Tori, do you want to start on that one?
Right. So there are two aspects here. One is coordination, and we discussed that yesterday. And I think that is fundamentally, this is a very important issue. And I think that if you take earthquake and other natural disasters, actually, because they have happened with some more frequently, you have now a better coordination between the different partners so that they really know, and you know who will do what and take leadership of what. I think that happened, for example, in the earthquake in Nepal. I think for the pandemic emergency facility, we touched upon it yesterday, but I would underline it, it will be fundamental in that process that one actually have a clarification in terms of roles and responsibilities, because, as was said, that money will go to different partners that then will deliver. So I think that is really very important. In terms of, earmarking, so we have the question of coordination is also a challenge, obviously created by that we gave money to Doctors Without Borders, Red Cross, and different agencies, and so I understand there was like 100 different partners at the country level which had received money that for specific tasks and so on, and then how you can get those coordinated and is a very hard task to do. And so obviously country leadership here is very important, but in terms of the way we finance, we have to think through that too. On the question of earmarking, yes, and I would say in broad terms, actually Norway has moved from giving budget support and sector-wide approaches to more specific earmarking to Gavi, Global Fund, and so on. And why? Because for two reasons. One is that the accountability for the resources were insufficient. So the last country we had that we gave budget support for health, our national accounts went to that country, and it was 25 pages of insufficient information relating to how the money was used. And the other thing is that you really don't get results reports. So the Parliament, you cannot tell Parliament what you got out of those investments. And so in broader terms, we are earmarking more, for sure. And I think my solution to it is that if you have a solid reporting on results, we will not care so much about actually the resource flows. And so Gavi doesn't have earmarking and so on. So I think that if you can address the results aspect, then I think we can follow through with not earmarking and asking for tracing the money.
This is a huge issue, definitely, and I want to just highlight one part of that that we experienced at USAID, which was the difficulty of even coordinating within the U.S. government, and this is because of the very complex nature of particularly this Ebola crisis. So within USAID, you have the Office of Foreign Disaster Assistance, and the Office of Foreign Disaster Assistance is the first responder in emergencies. And a lot of times those emergencies are earthquakes or floods. In this particular case, it was a human health emergency and a pandemic. So that required OFDA to coordinate among quite a few U.S. Government agencies, USAID, CDC, eventually the Department of Defense, quite a lot. So different types of money are being spent. OFDA spending its money because it had something like 6 or 8 other disasters that it was attending to around the world at the same time. They ran out of money. So then we had to kind of give money from the general USAID development budget to OFDA, which they then had to pay back once we got the supplemental appropriation. And then the supplemental appropriation came with all these different streams, 4 different pillars that we were given the funding to spend on 4 different types of responses, short and long term, to Ebola, and reporting that has to be done to Congress every 30 days. So this is a lot of work. And it's a lot of trying to put together very complex information systems, even just in USAID and then across the US government. CDC spent some of its funding, like in the very beginning, to begin to mobilize people, and then there was an appropriation to sort of assist them with that. So it gets really complicated, and I think someone was saying there aren't that many people who are devoted to this, in part because the people are devoted to other things. In the course of an emergency, and moving people from one part of the world to another to try to get them there when needed. So the systems weren't robust enough going into it to be able to support that kind of quick accounting. And afterwards, it's still a slow process to begin to figure out exactly what got spent by who when, and then how's that going to balance out in the long run going forward. So it is enormously complicated, even just in one contributor, and then across contributors. I think it's very, very difficult, in part because of bringing together so many different types of inputs.
Daniel, I believe you're next.
Thank you. Daniel Hanna, Standard Chartered. I just wanted to build a little bit on Prashant's earlier comment about agility, and I think that's actually one of the themes that seems to be coming up a lot of it. And just ask the panel to reflect on yesterday's conversation, which seemed to be a lot about how do we create new sources of money to respond to a crisis. And the balance between the importance of that versus actually just using the current sources of money in the right place at the right time, and building an agile system both at the donor level and the country level that can react to a crisis as it's emerging. And on that theme, I wanted to pick up on something that Gargi said about moving public multilateral bodies away from cash procurement to more other ways of, say, supply chain financing, and whether they felt that in a crisis such as Ebola that might have led or could lead to a faster, more flexible, and therefore more agile sort of process in response.
I see you taking notes, Gargi. You want to?
Yes and yes. So on the agile system, I thought yesterday's conversation was heading in the right direction in terms of anticipating the mechanisms that we're going to need to unlock financing quickly in the event of an emergency. I think that's the right place to focus. I think the sources of financing we know, and we should work with what we have. And so this is about building the structures that are ready to tap on demand. For the ex post part of it, the ex ante part, in a way, is harder because it's, how do you build momentum to invest in bread and butter capacity. On public procurement, others in this room will have views on this as well. This is something that we've been working with Tori, with folks from DFID for years. So it goes much beyond the emergency systems, but the need for public multilateral entities to have 100% of the cash on hand in order to procure products, I think we recognize is a major issue in the system. We have focused on donor disbursement as a failure there, as in why don't those agencies get the cash faster so that they can procure. But I think we could also do more to look at, does that have to be the case? We understand why. There's a sort of public trust, tolerance of risk issue, but what are the other mechanisms we should be looking to put in place so that those agencies can procure faster, knowing that they'll be backstopped? I don't know, Tori may have additional comments. Nope.
Anne-Marie?
Anne-Marie Kimball from Chatham House. One point and then a question. From the Accra workshop on resilient health systems, the overwhelming sentiment in the room, which was actually largely folks from sub-Saharan Africa, was that primary health care and strengthening health systems was absolutely crucial, independent of an emergency response. So, Gargi, I certainly align with what you said on that. The second thing that came out very clearly also came out from the Minister of Finance from Liberia, and that was the problem that's been created through donor activities, which is, I'm in Nigeria, I'm told that there are 1.7 or whatever billion dollars that we've received. Where did it go? And I find myself on the hot seat as the Minister of Finance to account for funds when I don't have insight into how those funds were spent on the donor side. And I think that was brought forward in Accra as a question, would donors be willing to look at a code of ethics among themselves on how they react to this? Is there some kind of agreements we could have for the next time where this transparency can be achieved? It's a hard question, but I just wanted to bring that forward into the discussion.
Jennifer, can I ask you to start on that one?
I think a code of ethics is actually a really good idea. I hadn't heard of that, but I think it is a good idea. I think how you would structure it is a complicated question, but I think it's a good idea. I think everybody would agree with the primary healthcare strengthening impetus and the centrality of that. And then I think it's there's a lot of levels to this. So you have the donor spending, and then you have the country plans. So I think think a lot of donors are looking at the country plans that the Ebola-affected countries developed and then trying to line up what it is that we have and what it is that we can use against those country plans. But that may not go far enough in the sense of following the donor funding, not just against sort of objectives and different areas that people want to work on within a pretty complex plan, but to the actual level of implementation and what organizations, when, where, and how. So I think that would be a good thing to try to develop. Again, I don't think anybody was ready or able to do that in this instance of the Ebola crisis, and it seems like now would be a good time to be able to try to take the effort and the information that we have, the experience that comes out of this, both good and bad, and try to put it to use in something that could be in place in time for whatever the future holds.
Adam.
Thanks, Adam Bornstein. So it's been a really interesting conversation, and I think where I feel as though I'm sitting right now is I still don't see a clear path for solving this funding issue. And maybe part of the reason is because it's really complicated, obviously, but also we're trying to pile in too many things at once and solve all the problems. And so thinking about what Jennifer was saying a little earlier about public goods and global goods, if we look at the pandemic, obviously it's a global good. And if you break down the sort of initial response and then the rebuild, and you say that the response is a global public good and the rebuild is like a public good, then you can kind of sort of start distributing the cash as to where it should go. So I just want to focus on the response because I think the response can be done fairly easily. And with the response being a global good, you have cash coming from around the world, and you also have kind of in-kind products or in-kind services. And I think what the Ebola experience demonstrated was that the military is really good at solving these problems quickly. And I think we haven't talked a lot about the military response, and this might be slightly controversial, but I'll throw it out there, that if we could actually pre-qualify military response around the world for these type of epidemics and have them jump in first, solve, set up, respond, it might be a really easy way, slightly controversial, but easy in the sense of allocating cash, because that would be done on that side. And then the donors focused on the rebuild, and they keep their systems going. Because there's no way we're going to solve this rebuild process and this kind of like long-term health system strengthening with any kind of donor cash upfront as a response, as well as on the back end. So they should just keep the systems going as they are, continue to rebuild on the donor side, and allow like the military and a quick response team to sort of deal with the response, as a suggestion.
Anyone want to take that one?
Well, I think on the military side, I think it's very hard to see that you could apply that universally. And it, you know, there would be political situation where that would be absolutely impossible. I would think that it's kind of a resource of last resort and can come up in certain circumstances. I think in this particular context, I would argue that AU may have been, in general, been a better position to actually to do it than that it came from further away. So there may be ways to think about this in terms of creating the logistics that is required, but that it's then regional mechanisms that are being developed to do it. I think that may be an interesting way forward. I don't like to think about this distinction between what is a sort of you know, health, what you call also global public good and sort of national public good or so on. I think they are highly intermingled, and I don't think that you will see that even if you call it a global public good, the global community is not going to put up the resources that are fully required to actually address these issues. It needs to be seen together. We are in a mode, as I have emphasized earlier, we are seeing our resources more and more catalytic. It is much, all ODA is going down as proportion of total investment transfers. The economic growth in many of these countries are much more rapid now than in the industrialized countries. And so it is, the pressure will be how to be as smart and catalytic with the resources that are available to address these issues. But I think we are living in a globalizing world, and I think you cannot really distinguish these responsibilities and say this is your, you should solve that in terms of finance and you should that finance.
I'm going to skirt the military part of that question, but I do want to reflect a bit the second half of your question and then some of the comments that were made just before you. I do think it's a more fundamental challenge we have to wrestle with around why don't governments really want to fund health system strengthening? And, I think Jennifer touched on that a bit, but I think we are in a bit of a vicious cycle where certainly public finance, ODA budgets are under immense pressure, threats to cut at every minute possible. A lot of misconceptions among the public, even elite public, about how much money is even spent on ODA. People estimate 25% of countries' budgets goes there when it's often, less than 1% or 2%. So that's sort of a macro level problem. And then it fuels a vicious cycle whereby donors say, okay, I have to be able to really justify my 1% budget that's going to this stuff. So I need the most specific, concrete, measurable outcomes to really defend that. So therefore, I need to fund the stuff that will give me that, and sort of give me cover to fund some of the other softer stuff that we all know is also important. And then advocates sort of work to tell those stories in the concrete ways that we can. But that leaves sort of health system strengthening as the orphan, the sort of long-term, unsexy, difficult to measure, it's certainly in the interim type of investments that no one really goes to bat for. So I do think it's a bit of a moment where Ebola has given us a bit of a window to talk about health systems, but I'm quite worried that window is quickly fleeting. And even for the US, the supplemental gives us a lot of sort of historic flexibility that we haven't had. But my fear is, once we get through those resources, we go back to a bit of business as usual. So I do think we need a bit of a sea change in political leaders, who are willing to step up and say this stuff matters, but also for advocates to tell a better story about what health systems means. We're really good at telling the Gavi story and what $1 means for a vaccine and a life saved. We're not so good at telling the health system story, and I think that fundamentally has to change if we're going to get out of this cycle moving forward.
I think that's a very important point. We are privileged having prime ministers that they gave a speech on the 1st of January to the Norwegian public. And then there may be one sentence about, global health or about education. They cannot use several sentences to explain what a health system is. And it is not a term used in the Norwegian context where one always talk about specifics. So from a political point of view, it's very, very hard to actually to convey. And therefore, our approach is that you actually disaggregate, like you were also mentioning. You talked about management, it's about finance, it's about human resources, it's about supplies, and it's about surveillance and response. And I think if you disaggregate it, then it becomes easier to also to convey, but it's also a challenge that we see as investors in Gavi, Global Fund, UNICEF, WHO, and so on. Would it be possible to say that, for example, the Global Fund would have a particular responsibility into surveillance and response, and that Gavi would take a particular responsibility in relation to supply chain? And in that way, at least we feel that our resources would be used better towards strengthening a health system, then the worst of all is that they are all involved in everything. But in that way, at least this way, I think we feel our resource would be used better for strengthening the health system. Thank you.
Good. We're getting short on time. I know Donald and Stacy have both been waiting, so if you can each be brief in your questions, and if panelists can be brief in their answers, hopefully we can get at least a couple more in. Go ahead, Don.
What are the implications for the kind of innovative financing, creative financing mechanisms we heard about yesterday, and in particular about the approach of letting 1,000 flowers bloom for the issues that Aaron raised in terms of tracking flows, filling gaps, but not having duplication?
I'll just piggyback on that. Bond markets, they trade, as you know, over the counter. And for a very long time, individual trades, banks didn't report price and volume information because it's not really in their best interest. And then this company came along, Markit, M-A-R-K-I-T, and had this idea that, it was in everybody's best interest to know everybody else's, price and volume information. So if you contributed, you got to see the price and volume information of all of the others. And they, have made $1 gazillion on this, and it's a very important information source for bond markets. What they did not say is, every bank should sign a code of conduct about how they want to, it was a very market-based solution. So it occurs to me that if Aaron's right, that this information is actually very important to, the correct allocation of donor resources, and if it is true that it's in donors' best interest to make better decisions on these kinds of things, and they want to do that, then there might be some kind of, market-based, incentive-based idea to better share both commitment and disbursement dollars, rather than you guys running around saying, oh, please give us your data, oh, please give us your data. And I'm just wondering, how much of that information is important to you? I mean, surely the number of people that are epidemiologists versus healthcare workers updated on a weekly basis is probably a nice to have, but there must be data that you think would really help you make better decisions on an individual basis. And what are those, and how could you be incented to kind of share that information?
We'll give each of you a brief chance at that one, or those two.
Well, I'll take the first one. I think very interesting. And first of all, I personally don't believe in the 1,000 blossoms bloom. I haven't seen the impact of that in global health in the 45 years I've been in global health. And what I think, and this also relates to your question to Gorgi earlier, we are in a situation, and this was the introduction too, that we now have a high-level panel. We have various review processes, and this is one. We have the question of the shape and form of the, the pandemic epidemic facility. And they will all come together at the end of this year. And it is a deliberate holding back on the basis of Chancellor Merkel, of Prime Minister Solberg, and together with Mahama, from President Mahama, that we don't want to preempt the recommendations coming out of the high-level panel that we asked the Secretary General to come up with, by now going for specific solution and specific investments. I think we will see a process starting, certainly after those recommendations, where the question of what are the major vehicles for investment in this space going to be, the size, the shape and form, that will come then in the beginning of next year, and it will, I think, then likely move fairly rapidly, but very clearly the G7 will be engaged, we will be engaged, others will be engaged, the bank will be engaged, the Gates Foundation is very much engaged. So that's my, you shouldn't become disillusioned by feeling there is nothing concrete coming out. It will come, but it will come early next year.
Jennifer, Gary, Aaron, can I ask one of you to address the part of the question around the value of transparency to you as donors or otherwise?
I can say something quickly, but it's really based not on emergency funding or pandemic funding, but on the kind of general development assistance funding that USAID has had for a long time. So in the past couple of years, a big push has been to make that data more transparent. And so USAID now puts all of its kind of data of where it's spending what on this platform, the Foreign Affairs Dashboard, which is then publicly available. And one of the things that we noticed was that governments and our partners didn't seem to be using this. So we actually sent a team to, I think it was Bangladesh, Uganda, and maybe one other country, to go and talk to the people in the government ministries about this. And what they were saying was, you know, USAID, unlike some donors, is a very decentralized organization, and we have local offices. So in those places where we had a lot of money and a lot of local offices, what they said was basically, well, if we want to know something, we call up your local office, and they come over here and they talk to us. So they sort of liked that, you know, that kind of a way of getting information, as opposed to going to some big database or a dashboard and just downloading the information. It was a lot more effective for them to be able to have an actual conversation. So I think the transparency part is very important, but I think it's also important to take into account the needs and the preferences, in some sense, of different users of that data, and it's all, in our experience at least, not identical.
I like your idea because even if the information was very insufficient to us, it was important, whatever information we got in relation to our investments. And I like your, and I'm sure if it were incentivized, so let's say that if we now put money into that kind of marketplace or dashboard and then got the information available from USAID and others, I think there would be an incentive to actually to do it. And so I like your idea. I think in that way you could really get it much better, faster and easier than knocking on the doors to the different donors and ask for information.
I would also just say, I think you have to think about a lot of different audiences for data transparency. So it's not, in my mind, actually, I was thinking less about donor-to-donor coordination and much more about implementers on the ground who are looking to make real-time decisions, who often aren't in government, civil society advocates looking to track resources and make sure they're allocated most effectively. And I think they don't always have the privilege or the benefit of having a relationship with a country director, or maybe they do, but there's 12 donors in the country, so they have to have 12 different conversations with donors to get a full picture of the resource flows. And I think the answer that the Liberian government representative gave on the panel before us is pretty indicative that there is a problem. I'm not necessarily saying that one big data portal will fix it all, and I think you do have to think about multiple end users. And I'm also not advocating that one should be or an organization like one needs to be the holder of that information. I think it would ideally be much more systemic. But I was struck by your question because I was thinking the same thing yesterday. I was sitting in the room listening to conversations around risk modeling and insurance models, and I'm not expert in that, but I kept thinking, my God, how are they going to build those given what we know about how terrible the information is? So in some ways, I'd love to turn the question back to the experts, maybe over lunch, about what implications that does have for their thinking and their modeling.
Final word to Gargi, and then we'll break for lunch. Please.
I don't know if it's final word, but two quick things in response to the questions. Just first, on the innovative finance question, I think one piece that didn't come up yesterday but is very important is that these are all just mechanisms bolted onto existing institutions, right? So we talked about IFM yesterday as though it were a separate entity, and it is legally, but from the perspective of recipient countries, it's Gavi, and it's indistinguishable which bank account Gavi draws on to deliver finances to these countries, and that's as it should be. So I think the question for the innovative finance mechanisms is, which is the global leadership question in the event of another pandemic? Who's in charge? Who's on first? And then we can bolt on the bank accounts and the bells and whistles to finance the entity that needs to deliver the resources. On Stacey's question, I think there are a lot of efforts now to get more transparency, both on the donor side and the country budget side, and they're all sort of imperfect, but they're much better than nothing, and people just need to do more of those. I think the real gap is something Tori mentioned earlier in the panel, and that's on results. After 50 years of development assistance, we have extremely poor ways of measuring, accounting for, delivering, comparing the results of spending on the same thing, and I think that's where we need to focus.
Great. Please join me in thanking our panelists for a good discussion.